Hi, everyone. Good afternoon. It's a pleasure to be here with you. My name is Luis Andrés Valenzuela, and I'm a last year medical student from Autonomous University of Ciudad Juarez in Mexico. And I did this work with the support of one doctor, Dr. Balan, who is a second surgery resident of general surgery in one hospital in Mexico, in Campeche. This is a very important topic in the next Mars expedition, so we are going to start. First, we are going to see an introduction of this topic. Well, in long-term space travel, like a trip to Mars, first we must consider common pathologies that can occur on Earth, or like as acute appendicitis that is treated with surgery and represents the most common emergency surgery in the world. Actually, the NASA Integrated Medical Model has recognized that appendicitis is very probably occur on a trip on Mars. So NASA and other space agency and other scientists are saying the last 10 years that the training for this pathology, acute appendicitis, will be conservative treatment. And what means conservative treatment is medications, excluding the possibility of space surgery. The space environment changed the pathophysiology, the natural history of this disease, and the proposed treatment has a lot of limitations. So we are going to check these limitations and propose another treatments. Well, this slide show why it's very important, this research. These are some problems of this conservative treatment. A lot of scientists has been evaluated the effectiveness of conservative treatment, and his conclusion is the failure rate is around 30%. If we wish to have success with this conservative treatment, again, medications, we need to demonstrate the absence of appendicular perforation or appendicular tumor or neoplasm or cancer, well, we need to demonstrate this by computer tomography, and well, in the space, an International Space Station on another space trips, we don't have available this diagnostic tool. Otherwise, conservative treatment don't work if we don't have this tool. Now, most of the astronauts are over 40 years old, and they have risk for appendicular cancer, and surgery is indicated. People less than 40 years old, I don't know, 30, 35 years, 24 years, have no risk of appendicular cancer, but all the astronauts, or most of the astronauts, it's 40 years or older. Speed radiation and galactic cosmic rays outside the magnetosphere will increase on Mars missions, and this may cause cancer and also appendicular cancer. Mars missions, and it represents a risk for neoplasia in the appendix. We never go outside from this magnetic ball, from this magnetic camp, because we did all the flight inside the magnetosphere, like International Space Station flights. Now the methodology of this study, of this research, well, we did a systematic review in July of this year.
Sorry to interrupt, but we're getting issues that we can't see the slides. Can you try sharing your screen again? Oh, nope, there we go. Now it's working.
Oh, okay. Oh,
it's on the methodology page. Yeah, there we go.
All right, thank you. Well, in this methodology, we did a systematic. I'm gonna go more faster. Well, the first topic is diagnostics in issue. So we have three parameters to use on planet Earth to diagnostics appendicitis. I manage studies that represent the gold standard. I mean, the best tool to diagnostics acute appendicitis. Blood studies and clinical score give us an orientation and diagnostics, but do not confirm the diagnosis. Today, the blood tests are possible in space with a complete blood count. We can find neutrophilia and leukocytosis. In a blood chemistry shows bilirubinemia, high levels of protein C reactive and ALT. It's very important to know these tests give us an orientation, but do not confirm the diagnosis. Another tool is scores, the clinical scores, and also are available in space. This must be evaluated by one flight surgeon. We have old scores and obsolete scores like Alvarado and others newer like Repasa, AIR, and AS. More than one score should be used, and again, only give us an orientation and diagnosis. We don't have all the imaging diagnostic tools available in space. In the fact, the best tools is CT, computer tomography, but it's not available in space because it's very bigger. Ultrasound is the only imaging tool available in space today. We can bring portable X-rays, but are not very useful. Ultrasound is a good tool for diagnosis appendicitis. However, it's operator dependent, and we need a lot of training to perform this machine. This table is a comparison of diagnostics methods in space and Earth. We can see cannot have computer tomography in space again. We need addition X-rays and laparoscopic surgery for the next Mars expeditions. As we said previously, CT cannot be taken in space, and it's very important because we need this machine to indicate a security or secure conservative treatment, and it's a gold standard. Now we will talk about conservative treatment. Conservative treatment has some advantage. First is 70 to 95% effective, and it's safe. This treatment combined with percutaneous drainage can resolve around 90% of appendicitis. It's a minimally invasive and less recovery time. The surgery needs 1 or 2 weeks of recovery. The antibiotics usually used are quinolones like moxifloxacin, levofloxacin, and could be oral administration, or also we can administer ertapenem and metronidazole by intravenous administration. This is a very important table because we have a timeline in research with conservative treatment. As we can see here, in some studies like Olias and Vargas, the successful is 95%, but in another studies, it failed up to 35%, causing the patients to operate. Some disadvantages and considerations, this pharmacology treatment called failure in 30% of cases. How we can see this. Sorry, can you see? Can you?
I can hear you.
Hear me?
But your screen's no longer being shown.
I'm gonna turn off my camera. I don't know why. Maybe it's the internet connection. You can see the slides?
Yes. It's on the methodology page.
I'm gonna turn off my camera. Maybe is that.
Yeah, hopefully.
Well, yeah. Well, disadvantages and considerations of the conservative treatment doesn't work if you have sepsis, perforation. These complications require a medical doctor with training in intensive care medicine or internal medicine. Necrosiding facilities can also happen, and antibiotics as monotherapy don't work in cases of complicated appendicitis. Galactic cosmic rays and the space environment can raise bacterial resistance and be more difficult to treat with antibiotics. In addition to this, the appendix can change or proliferate the bacteria by the cosmic radiation. This is an image with X-rays and ultrasound, and it's important because X-rays must be carried on the flight. because we can identify some appendiculitis, and in another way, we can identify some tumors in the appendix by ultrasound. Well, surgical treatment, with some modifications in microgravity surgery, we can perform surgery. Animal models have been already operated in the International Space Station on parabolic flights. I very like this image because represents probably future in space medicine. We can see how the surgeon used robotic surgery. The patient and the surgeon are tied to avoid the movements of microgravity. This is the dream of many of the people are here. Maybe one day our children can travel to the planet Mars without risks or without the risk of these pathologies or another pathologies. The best good point of the surgery treatment that is highly effective, around 90% or 99% of cases. Unfortunately, there are some cases that are going to be complicated by anesthesia, bad surgeon techniques, and infection. Now, what will happen if the flight surgeon gets sick? These types of complications and situations tell us we need to consider more doctors in the group. In my personal opinion, we need a surgeon, an anesthesiologist, or an intensive care doctor in the crew. Fortunately, surgery, it works in complicated and uncomplicated cases. Antibiotics only works in uncomplicated appendicitis. Another fact, laparoscopy can be performed in case of not having a diagnosis, treat all complications and all situations in appendicitis. We can use different surgical techniques, such as a traditional laparoscopy or other techniques. Unfortunately, we have many barriers to performing surgery. Laparoscopic surgery, we need a light source, laparoscopic tower, insufflation equipment, trocars, laparoscopics, 1TB, sutures like Bicryl, catwalk, Prolene. We propose in this research some new techniques to treat the appendicectomy for with surgery in space. However, the best way is laparoscopic, but requires a lot of equipment. Open surgery should be not performed as the aircraft. Why? Because microgravity can move the blood and fluids and contaminate all the ship. Organ eventration is another fear in open space surgery. Therefore, minimally invasive techniques are the best option, and we need a team of four people to get success. Recovery time is more longer than antibiotic therapy. Well, this is the first surgery. This technique, proposal surgery, is SILS. SILS is a single incision laparoscopic surgery. This technique must be used in space because you can see here only one incision is made through the navel. Another technique, another technique is endoscopic techniques such as ERAT. Consists of placing a stent, like cardiovascular stent is the same, in the appendix. Do not make incisions, and the patients have a good prognosis. Well, I say the laparoscopic surgery is the best option, but here we can see the robotic surgery is another option, but requires too much equipment and a long of training. If we found a solution of the problem of communication from Earth to Mars, the surgeon can operate from Earth to Mars. The robot surgery machines is the Da Vinci and Microhand. Another consideration is the anesthesia. Anesthesia, according to scientifics like Carrillo Esper, the general anesthesia or endotracheal intubation are the best options to perform a surgery in space. Perform regional blocks should be avoided because it's more difficult to use or perform by untrained doctors. Another point, remember, the space causes nystagmus in the eyes of the astronauts, and this can make it more difficult for the vision or the surgeon skills. In case of operating on Mars or any other stars, we must first adapt to the G-forces. We can use 3D print for some medical supplies, but another cannot be printed, like laparoscopic tower. We need to develop a software with artificial intelligence to assist us in case of human error, or we don't have having a diagnostic quick situations like emergency administration of some medications. The software requires an advanced algorithms. It's like something similar like the Iron Man in the movies. In the anesthesia practice have also been performed in parabolic flights, and they demonstrate it's possible with some modifications in space. Well, this is another option to treat this problem of acute appendicitis before the spaceflight. Prophylactic surgery prior to extended duration spaceflight is a benefit or the risk. Well, this possibility is perform appendicectomy and cholecystectomy, but recently we demonstrate the appendix derived in mesenchymal stem cells like osteoblasts, and if this is true, may not help in the bone loss by the space environment. Pathophysiology in space. Finally, well, there are some factors associated with space environment. I will tell you again, space causes a dysregulation of the immune system and infections are activated. This is very common in astronauts, activation of herpes and another infections, viral infections. The bacterial flora can change and become more resistant to the antibiotics. On the other hand, the immune system response is affected at the level of cytokines and leukocyte formation. Well, this is very important consideration, because if you don't find a leukocytosis in the medical scores, could be not shows a clear diagnostics of appendicitis. Chicken legs and puffy face may occur, and therefore the cardiac output increases at the appendicular level, and during the surgery, an hemorrhage can bleed more. Cicatrization, according to animal models, takes more time in space. Well, I wanna, okay, this is not gonna, all right. Well, this
5 minutes.
Yeah, this we propose this algorithm to be used in long-term space travel. If we have suspect of appendicitis, perform scores. Well, next to the perform scores, we need to have blood tests and imaging methods. If it's in acute appendicitis without complications, appendicular or neoplasma, guided by ultrasonography and X-rays during a trip, we will start to conservative treatment. But if the appendicitis has recurrence or complications, we need to perform a surgery by laparoscopic surgery, single incision laparoscopic or ERAT. Finally, if we found an appendicular cancer, we need to realize an histopathological study and consider the age of the patient to wait or take a quick decision. In conclusions, conservative treatment should be used as the first treatment and surgical treatment. Well, in the first treatment will be the antibiotic therapy, and the second should be the surgery. More research is needed in a new surgical techniques. At least one, Italy, 2 of the crew on a trip to Mars in long-term space missions must be surgeon, anesthesiologist, or intensive care medicine. The surgical technique of choice is laparoscopy. Thanks for invitation. I hope to see you in the next Mars annual convention.
All right, thank you. We have a question from AltSpace. You guys want to go ahead and unmute yourself and ask your question?
Let's see. Are you able to hear me yet?
Yes, we can hear you.
Yeah.
Oh, fantastic.
Yeah, I can hear you.
Thank you for the presentation. I wasn't quite clear. I wanted to ask you if you can clarify the appendix. What is its purpose? Do we have a better sense of that? or any detriments to removing it before before launching?
You're
Well,
muted. Oh, there you go.
it's not very clear, but the appendix is related with produce some mesenchymal cells, and it depends of the human depends of the human body. Could be could be derived in osteoblasts or lipoblasts or many cells, but it's not clear at the. So the prophylactic surgery could be a good solution.
Okay, so and
Is that clear?
even in space, do we have a sense that there's anything different within that in space, I suppose?
It's not clear because we never analyze the function of between the appendix in space and the appendix in Earth, because and so it's not clear. Maybe will be changed, but it's not studied at the.
Indeed, it's a mysterious little thing. Thank you so much.
Thank you too.
Great. Thank you. Are there any other questions?